welcome to the Tooth Be Told podcast. My name is Erica, and this is Brandy.
Hello, how are you?
If
Wait,
you're joining, if you're joining us for the first time, as always, we definitely want to give you an idea of what we're here to help out everyone out with. So first, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, our Black, Brown, anyone that needs the assistance, with the information and tools to improve their dental health care experience.
Yes, absolutely.
So today's episode, we're going to focus on racial disparities.
Yep.
If you're not unfamiliar with racial disparities are, I actually pulled up the CDC's definition of what this is. So the Centers for Disease Control is what CDC stands for, if you're unfamiliar. They define health disparities as preventable differences in the burden, disease, injury, violence, or opportunities to achieve optimal health experience by socially disadvantaged racial, ethnic, and other population groups and communities. So, in layman's terms,
Thank you. I was about to say, break it down.
in layman's terms,
Break it down.
non-white people are being treated differently when it comes to their health care. I'm sure that a lot of people have heard about maternal health care in regards to Black women, other brown women, the fact that, our babies are dying at higher rates. When we're telling them that we're hurting or we're in pain, this has been going on for centuries, obviously, with many things. They just treat us as if, we can handle the pain, because we're tough. But we're people, just like everybody else. So that goes along with, not being treated equally.
Absolutely. Yeah, I think we are treated less than human a lot of times. And so, yeah, definitely what you were saying about the women, women of color, Hispanic, Black women, with the maternal issues, they are not being taken seriously when they're having issues. And a lot of babies and mothers giving birth are dying up until this day. So it's a problem that needs to be addressed. And that also goes into all forms of healthcare, just like what we're talking about today. So the racial disparities we're going to be talking about are going to be focused on dental care and oral health and dental healthcare workers.
Right, exactly. So when I was researching some of these things, I said to myself, I reached out to a couple friends. We discussed that, previous to today's episode, some of the things that we would discuss. So I talked to a couple of friends of women of color, and I asked them, I said, hey, have you had any issues with racial disparities? And good news is they had not in regards to healthcare. So that's a positive, of course. But one of them had said to me, but she is always trying to find a Black physician, whether it's a dentist, a eye doctor, gynecologist, and she has a really hard time with that. And so I had looked up something just to give some more facts in regards to that. So compared to the overall U.S. population, Black Americans are sorely underrepresented among dentists. They make up 12.4% of the country's population, but just 3.8% of our dentists. So, and meanwhile, white Americans comprise 60% of the U.S. population and 70.2% of the nation's dentists. So those numbers are, so far apart.
Yeah. And you know what, Erica? So I believe you said you were looking on the Centers for Disease Control website, so the cdc.gov. But I wanted to add to that. So yes, I had that, but they gave also a breakdown of what those percentages were like in 2005 versus the percentages I think it was in 2020. So white dentists made up 70% of dentists in 2020. In 2005, it was 80%. So it's a small difference in all that time. I mean, a 10% difference. And also Black providers were 3.8%, like Erica said, of the population in 2020, but 3.7% in 2005. That's 15 years. And it's
Yeah.
up a point of like a point of a percent. Like that's insane to think about. Um, so for your friend who you're talking to, yeah, that makes it impossible to find, a black dentist, a Hispanic dentist, anyone of color. If you want to, if you want to go somewhere else and you want to be like, yo, I want to see my people, it's hard to find. Um,
Yeah.
and as a black hygienist and working with other like black dentists, it is a small community. Like we all know each other. It's like a handful of us. And I'm talking about in the state of New Jersey. Like we definitely all know each other. And it's a really crazy thing, but it's something to think about. It's hard to find. And then when you find them, you want to make sure they're reputable as well. Just because they're black, are they going to be providing quality healthcare? I mean,
It's
that
true.
needs to
Just
be considered.
that is true as well. I mean, any doctor, you want to do your research just because you might feel more comfortable with them because, you're more comfortable with someone that looks like you.
Yeah,
Doesn't mean that they're going to be, I'm sure I know that we've talked about this in the past. You've
all
run
the time.
across all types.
All the
And no
time.
matter what, color they are, doesn't mean you're going to get the best
Listen,
health care.
absolutely not. That means nothing. But I mean, if we had more to choose from, if there was a bigger pool of us, then we could be like, okay, okay, I've had so many little kids that are coming into the dentist for the first time, and they're like, "Mommy, oh, she looks like me," and they're like, "Oh, I'm so glad
Oh,
that my daughter got to see somebody that looks like her." That means a lot. Representation means everything. And when I was a kid, Erica, I don't know about you, but I don't remember any black doctors that I've seen. I think there was one. There was one black doctor. I remember. I was like teenager. Um, it wasn't a dentist. I think she was like it was like a PCP or something like that. But yeah, no,
I don't I don't recall any either. And then but also it's geographical, I guess, because of where we're from. Like
well, that's
it's
true. I mean,
predominantly, a predominantly white area.
but
So
you
I
know
mean,
what? I don't know, Erica, that has anything to do with it because there were some places that we went in areas that were predominantly black where the providers were white
well, there you go.
because there's no black
I'm trying to
provider.
think why. Why would it be?
No, but
But
I think that that's not it. I don't think
yeah,
that's it. I see why it makes sense, but I don't think
yeah.
that's it. I think that there's just more, and we know that. We don't think it. There's just more white providers. There's just
Mhm.
more of them.
Right. Do
The
you think
opportunity is there for them more than it is for us. And
what
we're not thinking about it either. We're not thinking much about it.
it could be too the opportunities that we are given when it comes to higher education, you know, the cost of it,
It's
the
all that.
it's all that. Like
It's all
when
that.
you're in high school, are you being guided in that direction? Are you being guided in that
Absolutely
direction in
not.
the home? Um, you know, then of course the population overall, it's less of us. So of course less of us are going to be doctors because there's not
But I
as many.
also think too, so I like you said, there's are you being steered that way by parents? Are you being steered that way by educators? Are you thinking of it because no one I knew anything about dentistry. I never no one ever talked to me what a dental hygienist was. Like I just was like, yo, this sounds different and I don't want to be a nurse. Like everybody I knew was a nurse and I
She's
love
like, I love.
nurses and I was going to be a nurse, but I was like, man, I really just want to I never want to do stuff like anybody else. I always want to be different. And I was like, maybe I'll try this. This might be cool. So when I started as assistant, I was like, oh, I love this. Now I want to work on my own. Like I don't want to be with no doctor. I want to be by myself. What can I do? So that's when I went back to school. But there was no black girl. Like I was the only one in my class. There was one before me,
Mhm.
and there was one after me. There's one black girl in each class, and we all know each other still. Like it's really crazy to think, and nobody's thinking about being a dental hygienist.
Well, what about
Nobody black.
well,
It's rare. Like, my niece, Christina, she is like, there's, a few people that I can pick and say, but it's
mhm.
not something overwhelming that we want to do. It's just not put out there for us. Dentists, hygienists, oral surgeons, any kind of
Have you ever thought
specialist.
about being a dentist?
I did, but it's too much. I just want to go home make my money and leave. I don't want all that responsibility
Too
because
much
it's a lot of responsibility.
responsibility.
And when
Yeah.
I leave for the day, I want to be done. I don't want to have to think about nothing. I don't want nobody calling me with emergencies. I don't want.
Mhm. Because that's
I'm
how it
good.
is.
And
More,
listen,
more money, more problems.
exactly. And it's not that big of a difference in money, especially now. Like, it's not enough for me to be like, oh, okay. Yeah, I'm going to definitely do that. Not with the schooling you got to do and all the loans you got to pay and all this, like you were saying earlier.
Yeah.
So you're
There's so
right.
many factors and why. But I mean, when I'm on social media, I see a lot of them now. A lot of people of color graduating,
Yeah, you
going to
you do
medical
right.
school.
You
You
do
see it a lot
on
more
social
now, which
media.
is a good thing, which is good.
It's
But
really good. I love to see it. I love to
yeah,
see
yeah,
it.
the white coat ceremony. Yeah.
Look, and be serious. But guess what? Do you know any in this area? Like a bunch coming
I
here?
do, actually. I do. I actually do know a black dentist. He actually lives in my development. So
I
I
know who
do.
that dentist is too, but
You
I'm
do.
talking about, do you see a whole bunch coming into this area? I know who he is
No, no,
because
and
there's
I don't even
all
I
before.
don't yeah, I don't even know where his practice is, but I just, I do know a black
I know where his
dentist.
practice is because there's a
Okay.
handful of us. That's what I'm trying to say. The
Of
community is
course you
so
know.
small.
Wait, I did take my niece, or I was with someone. It was a pediatrician that was in this area, and he was black. And I remember this is years ago, and I remember
This
bringing it
was
to your
with me. I
attention.
know. It was at my office.
No, it wasn't. It was in a. It was
It
not
was.
at your.
Not now, but I was there. I know who the doctor is.
Okay, so I had mentioned it to you, and I was like in such a shock. I was like, "Oh, there's this black doctor there."
And I was like, he's cool. He's good. Now he's on his own. He has his 3 practices. Like,
Okay,
yeah,
yeah.
he's a good doctor. But my point is, you don't see a huge influx into this neighborhood
No.
of black providers. Whether
And
it's
speaking on being good or bad, one time I was recommended a doctor. It was I'm not even going to say it was a doctor, and this doctor happened to be black, and I had like the worst experience with this doctor. The fact that it was just like an in and out type thing, and I was just like, okay, like you came highly recommended. I see all these people waiting in the waiting room. It took me forever to get
Mm.
to this appointment, and then you just like looked me over real quick and then sent me on my way, like in and out, like
and
you know.
listen, you can get that with any doctor. So that's what I'm saying. So my point is, you still got to do your research. Just because somebody's black and just because they're recommended doesn't mean that's going to be the person for you or that's going to work with
Hmm.
you. So it's all about shopping around, like we said in the past. But I did want to get to, so we talked about the racial disparities on, the provider side. So I just wanted to talk a little bit about, what's going on for children and adults. And I just wrote some things down. So, and you said, Erica, nobody said anything about, having any issues with care for themselves per se
No,
that you talked to.
correct. And I asked
Okay.
3 individual women of color.
So I
Yeah.
found this pretty interesting. This little note says that more people are unable to afford dental care than any other type of health care in the United States.
Hmm.
So if you think, have you always had dental insurance all your life? And if you're not working, the other thing that's interesting, like say you're on Medicaid, like in the state of New Jersey, you can get on Horizon NJH Medicaid plans. But it's also interesting that they are not required to provide dental care. So you could have your health insurance, and even if you have it through the state insurance, you're not necessarily going to have dental insurance because they don't have to provide that to you. It's not a thing, which I
Hmm.
find to be very strange that you
It
can
is.
get.
So uh, now, if you're getting it through the state, is there any type of form of payment for you to have this insurance?
You mean well, you shouldn't have to pay. Like, just say, like, if you're low income and
Mm-hmm.
or if you're out of a job, no, you wouldn't pay for that insurance. So it would be
Mm-hmm.
provided through the state. However, Horizon NJ Health, which is a state plan, they have dental coverage associated with them, and they usually cover everything outside of like a lot of cosmetic stuff. Um, but I thought that was interesting. And there was another thing I thought, and I listen, my handwriting is suspect because I don't even know. Okay. In 2015, the percentage of people in the United States without dental insurance was 29%. overall. But for older adults, it was 62%. These are people without dental insurance. So people just walking around who having issues with no insurance at all.
Well, that's not shocking to me because the older, like the boomers and above, in that older generation, like back then, healthcare dentists that they just didn't go, like they just
Right.
didn't.
It was different. Yeah, definitely
Yeah, it
different.
was totally different. So I'm not shocked at all.
But I mean, this is in 2015. So it's
Oh,
not that long ago.
you did say that.
Yeah,
I'm
so it really
it's
should
still
be.
though. I guess yeah, it should be, but
It should be. And I'm trying to think there was some more
I mean,
kind
the
of
proof is in
staggering
the
stats.
numbers.
And then regarding children, so anybody who has small children, hold on, y'all. Please be patient because I was
She going
writing
through her notes,
down stuff.
y'all. She
Yeah,
going through her
I was
notes.
writing down stuff. So children between the ages of 2 and 19 years old, and this is cited from 2011 to 2016. Kids who are 2.5 years old, so that's 33% of Hispanics and 28% of Black children. They all had cavities in their baby teeth compared to
Mm,
10% of white children. That's a huge number. And then when you go up, so if you go up to ages 12 to 19, that's 70% of Hispanics. They had cavities in their permanent teeth. So from 12 to 19, adult teeth compared to 50% of white Americans. So you got 70% of Hispanics, 50% of whites. White Americans are more likely to have dental coverage. They're more likely to bring their children to the dentist before the age of 2. They're more
hmm
likely to have them on a regimented schedule every 6 months. So it is something to think about. Something is missing, and I think it has a lot to do with ignorance, but it has a lot to do with the things you were saying too earlier, Erica, that is just not available, and people don't know how to take um, advantage of the things they have in front of them.
I mean,
So
let's be honest. We're gonna talk about our own people, and then sometimes that's not important. Other things are more important, like a new pair of sneakers, or a nice new jacket, or something that's popular, or something like that. Like you know, vacation or something like those things are not important to spend your money on.
yeah, I think our priorities as a whole
Yeah,
are not in the right place. And so we prioritize things that we don't need, but make us feel good and that we want.
right.
You know
Because
what
you
I'm
feel like I
saying?
work hard, I deserve to treat myself, and then if you're not having no pain or no issues,
You
then
just be like, it
I'm
goes by
just
the
gonna
wayside.
I'm gonna spend my money on this. I'm not gonna spend my money on that. And then when it gets to the point where it's a real bad situation because you didn't take care of it when it was small, now you got to spend more
Mhm.
money on it.
Yeah, and it becomes a lot. So
Yeah,
I'm wondering if we should part to this
I
because
think so.
there's a lot more I want to go over. Especially, I also want to add some resources for you guys who don't have dental insurance, how you can have your dental coverage paid for, how you can get on plans at your office. Each dental office has a plan where you don't necessarily have to have insurance, but you can still get your checkups and cleanings. I want to give you guys information on that. And I also want to give you more information on the statistics um, for white Americans versus Black, Hispanic, and Asian Americans, because there's like some staggering ones. But I think we'll part to that because we don't want the episode to be too long and
No,
lengthy.
we don't. We
Um,
don't.
but
Too.
yeah, I think we will definitely do that. I didn't think we would have to, but it's also good conversation too, like to
Mm-hmm.
just talk about it, talk it through. And I think it's an important topic, and it's worth a part two. What do you think, Erica?
Absolutely. I definitely do. Because it's I didn't expect us to be going. I was like,
Listen,
wow,
because
we
we could
we
talk all day
yeah, we could talk a long
and
time
sit
about this
back
topic.
all day.
Yeah.
You know what I'm saying? And
Mm-hmm.
it's an important subject, so I think we should
Yeah.
definitely part two. But there were some things I wanted to talk to you guys about as far as just getting you in the chair, helping with finances and things like that. So we'll hit that on the next episode.
Yes,
Yep,
next
I think
episode.
that would be good. Yeah.
Yeah.
Mm-hmm.
So, as always, you guys tune in every Friday. You can check us out on www.truthbetold.com. truthbetoldpodcast.com. You can also go to our Instagram. It has a link to our website as well that has all of our videos on there.
Mhm.
YouTube, Facebook. Our Instagram is Truth Be Told Podcast. So check us out.
Yes,
Um,
please do. Like, follow, share,
yes,
subscribe,
like,
leave
follow, share, subscribe.
questions,
Yeah, you
let
can
us
send
know.
questions on the website, and Brandy will answer those questions, not me. I can't, I can't do that because I chose not to go into the medical field because I knew that wasn't for me.
Right,
Just like you
right.
said, you wasn't
A
being there,
whole lot.
and I'm so proud of all of our, that I just know me as a person. It just wasn't for me.
Yes, listen, we need y'all. So
Yes,
absolutely,
you got
we
to know
need
what you're
y'all.
good at.
You do. You gotta know.
Yes. All right. So thank you so much again for joining us, and tune in next time.
All right, guys. We'll see you
All right.
later.